I'm Amy Goodman.
And I'm Juan Gonzalez. Welcome to all of our listeners and viewers around the country and around the world.
Juan, before we begin with the election results around the country, Puerto Rico is in the news with a major march going to be happening tomorrow.
Yes, I wrote a piece in the Daily News today in my column talking about this massive march that's going to occur in Puerto Rico tomorrow, basically around the discriminatory practices of Medicaid and Medicare and its funding toward Puerto Rico. And what's unusual is that both the governor of New York, Andrew Cuomo, and the mayor of New York, Bill de Blasio, will be going to San Juan tomorrow. They'll be participating in the march. There's also an annual conference of Latino elected officials in San Juan that they're attending. But the idea that the mayor and the governor would be participating in a march against the federal government and its treatment of Puerto Rico is really unusual. The governor is also working with Puerto Rico to try to produce a Medicaid waiver that would allow at least $1 billion more from the federal government to go to Puerto Rico. But the reality is the health crisis in Puerto Rico is as severe, if not more severe, than the debt crisis, with over 300 doctors fleeing the island last year, with the healthcare system near collapse because of the unequal reimbursements. For instance, Medicaid does not pay for nursing home care or for long-term care in Puerto Rico. So if anyone has to go into a nursing home or has to be cared for, families have to pay for it out of their pockets. You have hospital waits, situations where most people who go to public hospitals have to pay for private nurses because there aren't sufficient nurses on hospital staffs to be able to properly care for them. And now the Puerto Rico is only has been historically capped getting about 15% of its costs in health care, whereas New York State, for instance, gets 50% from Medicaid. Poorer states like Mississippi and Alabama get 80%, yet Puerto Rico has been historically getting about 15%. The result is about $20 billion of the $72 billion debt that Puerto Rico has was incurred by the Puerto Rico government specifically to borrow funds to be able to pay its health care costs. So that's why this huge march about saving the healthcare system in Puerto Rico will be so important in the coming days.
And we're going to be playing in part of our 2 Thanksgiving Day specials your speech, Juan, this major address you gave at New York University on the Puerto Rico debt crisis, but going to the context, the historical context of colonialism in the United States.
And which, by the way, is accelerating because the Puerto Rico government has already announced that starting next week, they're going to be cutting hours of all government workers. By the end of this month, they will run out of money to be able to pay their normal expenses, not to mention their debt. So this is going to accelerate in the next few weeks.